And we're back, dear viewers, with our second guest. So, an orthopedic specialist, graduated from Charles University and a Kuwaiti board-certified orthopedic surgeon, earning 2 fellowships in pelvic trauma and hip preservation and joint reconstruction and revision surgeries. He serves at Al Jahl Hospital, an arthroplasticity unit, which was established in the 2024 years. So, dear viewers, let's all welcome dear Dr. Abdullah Alfaraj, an orthopedic specialist here in Kuwait. Good morning, doctor. It's such a pleasure to have you.
Good morning. It's my pleasure to be here today, and I'm looking for and thank you actually for having me today, and I look forward to contribute in your program and answer all the questions in a useful way.
You're most welcome, doctor.
Thank you.
It's such a pleasure to have you here to share all your insights for our dear viewers. But first of all, we'd love to know your journey of education here in Kuwait and when you went outside.
Yeah, actually I started in Kuwait. Actually I started in Charles University in Prague. That's where I graduated from my medical school. And then I joined the orthopedic board, where I earned a master and PhD. And then start my journey with a fellowship in Germany, where I did my fellowship in Hamburg. And then I went to Aachen. And I had multiple small fellowships in Switzerland and UK. Yes.
Wow, that's a really nice journey. You've been to a couple of different places.
Yes.
I'm sure you speak a little bit of German.
Oh, just a little bit, not much.
All right.
But because like most of the time they speak the English in Hamburg mainly.
Right,
yeah.
That's great to know, mashallah, bringing all that experience here
Yes.
back to Kuwait and serving the community for sure.
Sure.
So, doctor, would love to know about something called osteoarthritis.
Oof, that's a dense question for morning, isn't it? But I'll try to simplify it as much as I can.
Yes, please.
Actually, osteoarthritis is a degenerative disease hitting the joint itself and causing a loss of article surface. I know I'm using some terms, but I'll try to explain in details.
Yes.
This articular surface is actually the surface that covers any joint. Usually it should be smooth. Whenever it's roughened, then that time start osteoarthritis and the inflammation of the joint itself.
All right.
Yeah.
So that serves the knee, or which
That's
place
actually
is
in every single joint.
Oh,
That's
wow.
why sometimes they comes and tells you like, I have an osteoarthritis in my spine, osteoarthritis in my knees, osteoarthritis in hips. So it can hit any single joint.
All right, doctor. So when somebody notices that he has this medical condition, would you go for normal treatment or surgical?
Oh, this is a very good question. First of all, the thing is that we have to think about the risk factor of this patient before starting treating them. These patients usually, it doesn't hit, that's the fact that it doesn't hit only old people because of the tear and wear. Usually it can hit young patients. These young patients, usually if they have some history of any injuries, meniscal injuries, any previous surgeries, those guys are at risk of having this condition.
All right.
Yeah.
Also, and there's a special age limit for these conditions?
That's another good question. The thing is that about age, I see age in a different way. I see age not a number. I see age as a physiological age. So it depends. Sometimes I can see some patient that is only 45, young patient, but unfortunately has osteoarthritis. That patient, unfortunate, because of the history of any treatment before, he got the osteoarthritis. But in the same time, I can see an old man, I'm not going to say it old man, but let's say like 70s and above, that he's active, very active with a good muscle bulk. I don't treat him the same way. So it's all about the physiological age and his activities. It's play a big role.
All right,
Yes.
doctor. Very nice information for our dear viewers. I'm sure they're benefiting a lot.
I hope.
And doctor, since mashallah, you're also a specialist in hip preservation. Would you tell us all about it?
Oh, the hip preservation, it's a new concept. It's the thing is about hip preservation is we try as much as we can, we preserve that joint before replacing it, which it's one of my specialties in arthroplasty, joint reconstruction. So the problem is, before going through this joint reconstruction, I rather try to preserve that joint. It's usually such a cases like something called avascular necrosis. It's the blood supply doesn't reach the head. It's this condition in hip. The blood supply, because of the pressure, doesn't reach the head. That's the problem usually before they change the whole they go for hip replacement. But nowadays, we have some procedure that we can save that hip. Other issues like hip dysplasia, I don't want to go through it, but the problem is like there is no coverage, enough coverage for the head. Other things called hip impingement. The hip impingement, usually it's like when there is some bony protrusion in the hip, it can cause pain. And at the same time, it's depend if it's at the acetabular side or the neck of the femur. I know I'm using so much terminology, but the problem, I hope we will have some details I can explain.
Hopefully, inshallah.
Sure.
And so, doctor, this hip or the causes of this hip injuries, what are the early signs so people can know what's coming?
Oh, first, my first sign is pain. Always is pain. If you don't have pain, I wouldn't touch you. Sometimes some people comes to me, tells me like, I hear a click, I hear something, but does it bother you? No, then don't come, don't do nothing. Otherwise, if it's painful, that time, I will go with the whole physical examination, go with images, treating this patient in a different way. Yeah.
All right, doctor. So moving on to our next question.
Sure.
It's even harder.
Yes.
All about arthroscopic.
Today you are on fire. Yes.
Yeah. So, doctor, the treatment of open and arthroscopic treatment. Could you tell us more, please?
Another new concept. The thing is that we have two choices in treating the hip preservation. Usually we have the scope, and we have that which is arthroscopy. We go with a small, teeny tiny incision, and we go and introduce a camera into the joint, and we check the whole joint, and sometimes we can treat it. But sometimes we have to go the hard way, where we go with the open. We have to open the joint and check the whole joint and remove and treat all those conditions that we're talking about.
Oh yeah, doctor.
Yeah.
So you mentioned a little bit about these detailed surgeries.
Yeah.
Are these the new developments in medicine?
The hip scope, yes, it is new. The hip, something called surgical hip dislocation, it's not. It's an old thing. It's not an old school, but it's a solution. It's a very good solution so far. But we are nowadays going to the arthroscopic treatment.
All right. So, doctor, pelvic trauma classification. Would you please elaborate?
Wow, that's a big thing. But I'll try to talk about it in brief. Pelvic trauma. The thing, there is two types of classification. Let's say, it's one type. It's about the stability of that pelvic fracture, and the second one, it's about the direction of the mechanism of injury. So first of all, I will talk about the classification, where it's like, it's a stable pelvic fracture. That time, maybe usually we treat it with a conservative treatment, but sometimes if there is some unstable hip, we have to go with the surgical treatment. And the same things with the direction. It's either from anterior to posterior, or if it's hit from the lateral side, or it's depend if there is lateral. It's always about holding that pelvic ring as it used to be.
All right, so there you go, dear viewers. You heard it from Dr. Abdullah Alfaraj. If you have any issues, please, you can find Dr. Abdullah in Al Jahra Hospital.
Yes.
And you mentioned another hospital that
Yeah, actually, I started my clinic as well in Razi, but I'm based in Jahra.
Oh, really? That's really great.
Thank you.
So, Doctor, in the age of medicine, how do you see our Ministry of Health competing with the world?
Oh, no, really, trust me. We are going in the right direction so far. If you want, you can check Al Jahra Hospital. Now it's a new building. It's everyone planning to succeed. And actually, we are one of the best so far. But unfortunately, we always look for treatment abroad and stuff like that. But believe me, trust me, we are in a good way.
Inshallah.
Yes,
Doctor,
inshallah.
hearing it from you and hearing it from all of the people that Kuwait is significantly
It's leading. Trust me. Yes, trust me.
Yes.
It's leading. Yes.
It's leading, and they're about to build a new medical city here in Kuwait also.
Yes,
for all the people that used to travel outside, and they can now take care of themselves here in Kuwait.
True.
So, Doctor, we'd love to hear a last message from you for our dear viewers.
Actually, I have a one-take-home message. It's been bothering me for some time. I would like to say it. Two things patients shouldn't do. First of all, please do not Google before you go to your doctors. Google after you go to your doctors. Right. Googling before It's like you are trying to find a diagnosis and it's going to stick in your head. And whatever the doctor tells you, you will never be convinced. Second, stop doing doctor shopping. This is what I call it.
What is that?
Actually, it's like, you know, you go to seek treatment in every single doctor till that, whatever he says, makes sense for you, but it's actually is not the real thing, but just to make you happy. So these two things don't do. Just go to the specialist, and that time you will get the good treatment.
Definitely. Thank you for raising the awareness for our dear viewers, Doctor.
Thank you. Thank you for having me today. I hope I was useful and beneficial for our viewers. Thank you.
It is beneficial, definitely, Doctor. And you're most welcome here on our show.
Thank you.
So, dear viewers, we'd all like to thank our guest for today, Dr. Abdullah Alfaraj, an orthopedic specialist in knee and hip arthroplasticity, hip preservation surgeries, and also pelvic trauma. Thank you so much, Doctor.
Thank you.
So, dear viewers, now shall take a quick break and we'll be right back. Stay tuned.